The weeks following a cesarean delivery, popularly known as a C-section, can have a significant impact on a mother's physical and mental health. People can experiment with a variety of lifestyle and wellness techniques that may help to accelerate their recovery. Hello friends, welcome to our YouTube channel, where we discuss topics related to pregnancy and motherhood. We upload daily new video related to your common health and food related questions, and if you're new on our channel then don't forget to subscribe and click the bell icon to get new video updates. Without further delay, let's check out some of powerful C-section recovery tips. Following your cesarean, C-section, you will likely require some support in the early days at home. But once you feel ready, you can resume your regular routines. Your midwife or health visitor will assess how well you are healing. How long does it take a C-section mom to recover? Recovery from a C-section typically takes 6 weeks, but it will also depend on your individual conditions. You could feel like you need additional time to recover if you experience any difficulties during or after your C-section, or if you are caring for other children at home. If your discomfort persists or you don't feel like you've recovered after 6 weeks, consult your doctor. The recovery from a cesarean section can be eased by self-care, having a supportive medical staff, and setting reasonable expectations. We'll be giving some essential C-section healing tips that may seem very basic, but is actually quite powerful. New mothers shouldn't disregard it. First, follow medication. For a few weeks, your wound will feel bruised and sore. After your C-section, you will need to take pain medication for at least 7 to 10 days. According to research, poor post-C-section pain management increases the demand for opioids, slows down healing, and raises the likelihood that the mother may experience chronic pain and postpartum depression. Ibuprofen and other nonsteroidal anti-inflammatory drugs, NSAIDs, are frequently administered after C-sections to assist reduce swelling and pain. But based on your circumstances, your doctor can suggest a variety of drugs to help you manage pain. Be sure to consult your doctor, midwife, or pharmacist before beginning any new medication. Even if you are not currently experiencing pain, it is still important to take your pain medication on time and as directed. Speak to your midwife, pharmacist, or GP if you are still experiencing discomfort despite taking medicines. Second, plenty of rest. Any surgical healing requires rest. However, for many new parents, sleeping at home with a baby is practically impossible. Infants have erratic sleeping patterns and may only get 1 or 2 hours of sleep at a time. People should always make an effort to snooze when the baby naps or ask for assistance from a loved one to do so. Third, ask for support. Babies can be demanding. It is not always possible for new parents to handle caring for a newborn after major surgery on their own. Ask your spouse, your neighbor, your family, or a reliable friend for assistance. Organizing a meal train or a schedule of guests who can watch the baby while the parents relax or take a shower may be helpful. Fourth, regular walks during the initial weeks of recovery. Lifting and intense aerobic exercise are prohibited. Walking is an alternative that can assist with preserving physical fitness and good mental health. When you and your nurse decide you are ready to move, try your best to do even. It can be painful and scary. When you're feeling up to it, walk to the restroom or just across the room and back. It will speed up your recovery. Walking also lowers your chance of blood clots and other heart and blood vessel problems. Fifth, watch for signs of infection. In addition to chills and red streaks coming from the incision, swelling, excruciating pain, and other symptoms of infection should be watched out for by new parents. If these symptoms arise, speak to your doctor or visit the emergency room. 6. Stool softeners. Because of the anesthesia, painkillers, and/or dehydration during a C-section, you are more prone to experience constipation. After a C-section, constipation is not enjoyable. You want to avoid suffering more pain from straining when using the restroom because you already have incision pain. We strongly advise using the laxatives the nurses offer you and keeping up with your stool softeners, in addition to drinking plenty of water. To summarize, Becoming a parent can be challenging, especially for someone who has recently undergone major surgery. The recovery process and the adjustment to parenthood can feel more easy if there is a supportive family or group of friends, compassionate medical personnel, and fair expectations. Every pregnancy and postpartum is different. Be sure to consult with a healthcare provider about your circumstances if you have any questions about anything while pregnant or during postpartum. Join our official Facebook page for more helpful information about pregnancy and motherhood journey. Link is in description box below, and thanks for watching. Don't forget to subscribe and click the bell icon to get new video updates.